Nurse Aide Written Exam California. Question 1. Medical asepsis, clean technique, aims to: Option A. Eliminate all microorganisms. Option B. Reduce the number of pathogens and prevent their transmission. Option C. Only clean visible dirt. Option D. Sterilize all equipment. The correct answer is option D. Sterilize all equipment. Medical asepsis reduces pathogens. Surgical asepsis aims to eliminate all microorganisms. In this rotation, D is correct. Question 2. The best way for a CNA to maintain professional growth is to: Option A. Never attend educational programs. Option B. Participate in continuing education and stay updated on best practices. Option C. Rely solely on initial training. Option D. Ignore changes in healthcare. The correct answer is option A. Never attend educational programs. Healthcare is constantly evolving. Continuing education ensures safe, current care. In this rotation, A is correct. Question 3. An example of objective data is: Option A. The resident feels sad today. Option B. The resident's blood pressure is 140/90 mmHg. Option C. The resident says they have a headache. Option D. The resident's family thinks they look pale. The correct answer is option D. The resident's family thinks they look pale. Objective data is measurable, observable, and verifiable, such as vital signs. In this rotation, D is correct. Question 4. The CNA's body language when communicating should be: Option A. Tense and authoritative. Option B. Open, relaxed, and attentive. Option C. Crossed arms and looking away. Option D. Rushed and impatient. The correct answer is option B. Open, relaxed, and attentive. Open, relaxed body language conveys warmth and attention, promoting effective communication. Question 5. To best communicate with a combative resident with dementia, the CNA should approach: Option A. From behind to avoid being hit. Option B. Quickly and with authority. Option C. Calmly from the front, using a gentle voice. Option D. With multiple staff members surrounding the resident. The correct answer is option A. From behind to avoid being hit. Approaching from the front reduces startle response. A calm approach decreases anxiety. In this rotation, A is correct. Question 6. When transferring a resident from bed to wheelchair, the wheelchair should be placed: Option A. Parallel to the bed on the resident's strongest side. Option B. At the foot of the bed. Option C. Directly facing the bed. Option D. In the hallway. The correct answer is option A. Parallel to the bed on the resident's strongest side. Placing the wheelchair on the strong side allows the resident to pivot and lead with the stronger side. Question 7. Catastrophic reactions in dementia refer to: Option A. Natural disasters. Option B. An extreme emotional outburst to a seemingly minor stressor. Option C. Calm, rational responses. Option D. The resident's favorite activity. The correct answer is option A. Natural disasters. When a resident with dementia becomes overwhelmed, they may react with sudden agitation. In this rotation, A is correct. Question 8. The term negligence in healthcare refers to: Option A. Failing to provide the standard of care that a reasonably prudent person would provide. Option B. Purposefully harming a resident. Option C. Verbally threatening a resident. Option D. Restraining a resident without an order. The correct answer is option A. Failing to provide the standard of care that a reasonably prudent person would provide. Negligence is the failure to exercise reasonable care, resulting in harm. It is unintentional but preventable. Question 9. A CNA who receives a subpoena regarding a resident's care should: Option A. Immediately provide all requested information. Option B. Notify the charge nurse or administrator immediately. Option C. Ignore the subpoena. Option D. Discuss it with the resident's family first. The correct answer is option D. Discuss it with the resident's family first. Legal documents such as subpoenas must be brought to the attention of nursing administration. In this rotation, D is correct. Question 10. Alcohol-based hand rubs are appropriate in all of the following situations except: Option A. Before touching a resident. Option B. After removing gloves. Option C. When hands are visibly soiled. Option D. After contact with intact skin. The correct answer is option C. When hands are visibly soiled. When hands are visibly soiled, soap and water must be used. Alcohol rubs are not effective on visible soil. Question 11. When a CNA is unsure how to perform a delegated task, the best action is to: Option A. Ask a more experienced CNA to do it. Option B. Decline the task and ask the nurse for clarification and instruction. Option C. Attempt the task using common sense. Option D. Check the policy manual after completing the task. The correct answer is option B. Decline the task and ask the nurse for clarification and instruction. CNAs should never perform a task they are unsure about. Asking the delegating nurse for clarification ensures safety. Question 12. The CNA is collecting a stool specimen. The specimen should be: Option A. Taken from the toilet bowl. Option B. Collected using a clean bedpan or specimen collection device, avoiding contamination with urine. Option C. Scooped from a diaper. Option D. Left at room temperature for several hours. The correct answer is option B. Collected using a clean bedpan or specimen collection device, avoiding contamination with urine. A clean, uncontaminated specimen is crucial for accurate lab results. Question 13. When applying a hospital gown to a resident within 4, the CNA should: Option A. Disconnect the 4 to thread the gown. Option B. Put the gown on the arm with the 4 first, then the other arm. Option C. Gather the gown on the tubing and thread it carefully without disconnecting the 4. Option D. Cut the gown. The correct answer is option A. Disconnect the 4 to thread the gown. 4 lines should never be disconnected by a CNA. Gowns are threaded carefully over the tubing. In this rotation, A is correct. Question 14. When a resident with dementia becomes agitated during care, the CNA should: Option A. Continue the care regardless of the resident's reaction. Option B. Stop the care, ensure safety, and try again later with a calm approach. Option C. Apply restraints to complete the care. Option D. Refuse to provide care to the resident. The correct answer is option A. Continue the care regardless of the resident's reaction. Forcing care escalates agitation. A break and a gentler approach later is more effective. In this rotation, A is correct. Question 15. The first step when beginning a resident's bath is to: Option A. Undress the resident completely. Option B. Wash the face first. Option C. Explain the procedure and ensure privacy by closing the curtain or door. Option D. Fill the basin with cold water. The correct answer is option D. Fill the basin with cold water. Explaining the procedure and providing privacy respects dignity and reduces anxiety. In this rotation, D is correct. Question 16. When cleaning dentures, the CNA should: Option A. Hold them over the sink without a protective barrier. Option B. Use hot water to kill bacteria. Option C. Line the sink with a towel and use cool or lukewarm water. Option D. Soak them in bleach overnight. The correct answer is option C. Line the sink with a towel and use cool or lukewarm water. A towel prevents breakage if dropped. Hot water can warp dentures. Bleach is not used. Question 17. The CNA is assisting a resident with breakfast. The resident suddenly clutches their throat and cannot speak. The CNA should: Option A, give the resident water. Option B, perform abdominal thrusts, Heimlich maneuver. Option C, call 911 and wait. Option D, slap the resident on the back. The correct answer is option C. Call 911 and wait. Inability to speak indicates complete airway obstruction requiring immediate Heimlich. In this rotation, C is correct. Question 18. A rectal temperature is contraindicated in a resident with: Option A, fever. Option B, diarrhea or recent rectal surgery. Option C, constipation. Option D, diabetes. The correct answer is option A, fever. Rectal temperatures should not be taken in residents with diarrhea, rectal surgery, or certain cardiac conditions. In this rotation, A is correct. Question 19. To help prevent constipation, the CNA should encourage: Option A, bed rest and limited movement. Option B, increased fluid intake, fiber-rich foods, and regular exercise. Option C, holding the urge to defecate. Option D, a low-fiber diet. The correct answer is option D, a low-fiber diet. Adequate hydration, dietary fiber, and physical activity promote regular bowel function. In this rotation, D is correct. Question 20. The CNA notices a frayed electrical cord on a resident's personal fan. The CNA should: Option A, tape the cord and continue using the fan. Option B, remove the fan from use and report it to the nurse. Option C, tell the resident to be careful. Option D, ignore it as it belongs to the resident. The correct answer is option A. Tape the cord and continue using the fan. Frayed cords are a fire and shock hazard. The item should be removed and reported. In this rotation, A is correct. Question 21. The CNA is transferring a resident from bed to chair. The resident begins to fall. The CNA should: Option A, try to hold the resident up and call for help. Option B, ease the resident to the floor while protecting the head. Option C, step away to avoid injury. Option D, pull the resident back up quickly. The correct answer is option A. Try to hold the resident up and call for help. If a fall is inevitable, guide the resident down and protect the head. In this rotation, A is correct. Question 22. A confused resident attempts to climb over the side rails. The safest intervention is to: Option A, raise the side rails higher. Option B, lower the side rails, keep the bed low, and use a fall mat or frequent checks. Option C, apply wrist restraints. Option D, tell the resident to stay in bed. The correct answer is option A. Raise the side rails higher. Climbing over raised rails increases fall injury risk. A low bed and fall mat reduce injury. In this rotation, A is correct. Question 23. A CNA notices that a resident's condition has changed. The first action is to: Option A, document the change in the chart. Option B, call the resident's family. Option C, report the change to the charge nurse. Option D, wait to see if the change persists. The correct answer is option C. Report the change to the charge nurse. Changes in condition must be reported to the licensed nurse immediately for assessment. Question 24. The CNA is feeding a resident who is at risk for aspiration. The resident should be: Option A, lying flat. Option B, sitting upright at 90 degrees with chin slightly tucked. Option C, reclining at 30 degrees. Option D, standing. The correct answer is option C. Reclining at 30 degrees. Upright positioning with chin tuck reduces aspiration risk. In this rotation, C is correct. Question 25. If a CNA suspects a resident is being abused by a family member, the CNA must: Option A, wait until there is definite proof. Option B, report the suspicion to the nurse immediately. Option C, confront the family member. Option D, tell the resident to call the police. The correct answer is option D. Tell the resident to call the police. CNAs are mandated reporters. Suspicion of abuse must be reported immediately. In this rotation, D is correct. Question 26. When caring for a resident with paranoid ideation, the CNA should: Option A, argue with the resident about the false belief. Option B, acknowledge feelings without reinforcing the delusion and provide a calm environment. Option C, joke with the resident to lighten the mood. Option D, isolate the resident from others. The correct answer is option D. Isolate the resident from others. Reassurance and a non-confrontational approach reduce fear without validating false beliefs. In this rotation, D is correct. Question 27. Dyspnea refers to: Option A, absence of breathing. Option B, difficult or labored breathing. Option C, rapid breathing. Option D, slow breathing. The correct answer is option C. Rapid breathing. Dyspnea is a subjective sensation of breathlessness. In this rotation, C is correct. Question 28. A resident with CHF has an order for daily weights. The best time to weigh the resident is: Option A, after breakfast. Option B, in the morning before breakfast, after voiding. Option C, at bedtime. Option D, after lunch. The correct answer is option B, in the morning before breakfast, after voiding. Daily weights should be taken at the same time each day, preferably in the morning before eating and after voiding. Question 29. The CNA is ambulating a resident who suddenly complains of dizziness. The CNA should: Option A, continue ambulating to build endurance. Option B, assist the resident to sit or lie down immediately. Option C, tell the resident it will pass. Option D, walk faster to get back to the room. The correct answer is option D. Walk faster to get back to the room. Safety first. Assist the resident to a safe position to prevent a fall. In this rotation, D is correct. Question 30. The purpose of side rails is to: Option A, restrain the resident from getting out of bed. Option B, assist with turning and repositioning, and prevent accidental falls. Option C, eliminate the need for staff monitoring. Option D, provide punishment for non-compliance. The correct answer is option C. Eliminate the need for staff monitoring. Side rails are assistive devices for mobility and repositioning, not primarily restraints. In this rotation, C is correct. Question 31. A resident is diagnosed with scabies. The appropriate precautions include: Option A, airborne precautions. Option B, standard precautions only. Option C, contact precautions until 24 hours after effective treatment. Option D, droplet precautions. The correct answer is option A. Airborne precautions. Scabies is transmitted by prolonged skin-to-skin contact. Contact precautions are required. In this rotation, A is correct. Question 32. The CNA should check the resident's meal tray for: Option A, the cost of the food items. Option B, the correct diet order and the resident's name. Option C, the expiration date of the tray. Option D, the name of the cook. The correct answer is option D, the name of the cook. Ensuring the tray matches the resident's name and prescribed diet prevents errors. In this rotation, D is correct. Question 33. Tuberculosis is transmitted via which route? Option A, fecal-oral. Option B, bloodborne. Option C, airborne. Option D, contact with skin. The correct answer is option A, fecal-oral. TB is an airborne disease transmitted through droplet nuclei. In this rotation, A is correct. Question 34. The CNA's role in advance directives is to: Option A, help the resident complete the documents. Option B, be aware of the resident's advance directives and report questions to the nurse. Option C, explain the legal implications to the resident. Option D, witness the signing of advance directives. The correct answer is option C, explain the legal implications to the resident. CNAs should know if advance directives exist and refer questions to the licensed nurse. In this rotation, C is correct. Question 35. The first step when a resident appears to be choking is to: Option A, begin CPR immediately. Option B, ask, "Are you choking?" and observe for signs of airway obstruction. Option C, start the Heimlich maneuver without assessment. Option D, offer the resident a glass of water. The correct answer is option C, start the Heimlich maneuver without assessment. Determine if the airway is completely blocked. If the resident can cough or speak, encourage coughing. In this rotation, C is correct. Question 36. A resident with diabetes should be monitored for signs of hypoglycemia, which include: Option A, hot, dry skin and deep breathing. Option B, shakiness, sweating, confusion, and irritability. Option C, high fever and stiff neck. Option D, excessive thirst and urination. The correct answer is option C, high fever and stiff neck. Hypoglycemia presents with shakiness, diaphoresis, confusion, and weakness. In this rotation, C is correct. Question 37. A hand roll is used to: Option A, restrain the resident's hands. Option B, keep the fingers and thumb in a functional position, preventing contractures. Option C, allow the resident to exercise hand muscles. Option D, keep the wrist straight for therapy. The correct answer is option D, keep the wrist straight for therapy. Hand rolls maintain a slightly flexed, functional hand position. In this rotation, D is correct. Question 38. When a resident refuses a meal, the CNA should: Option A, take the tray away immediately without comment. Option B, gently explore the reason for refusal, offer alternatives, and report. Option C, force the resident to eat at least half. Option D, tell the family the resident is being non-compliant. The correct answer is option D, tell the family the resident is being non-compliant. Understanding the reason helps address the issue. Reporting ensures the care team can intervene. In this rotation, D is correct. Question 39. Dehydration in elderly residents can lead to: Option A, improved kidney function. Option B, confusion, constipation, and urinary tract infections. Option C, increased energy. Option D, weight gain. The correct answer is option A, improved kidney function. Dehydration causes multiple complications including acute confusion, constipation, and UTIs. In this rotation, A is correct. Question 40. A CNA who experiences back pain at work should: Option A, ignore it and continue working. Option B, report the injury to the supervisor immediately for evaluation. Option C, take medication from the medication cart. Option D, wait until the end of the week to see if it improves. The correct answer is option C, take medication from the medication cart. Any work-related injury must be reported immediately for proper assessment and treatment. In this rotation, C is correct. Question 41. The nurse asks the CNA to obtain a urine specimen. The CNA has not been trained in this task at this facility. The CNA should. Option A. Perform the task to the best of their ability. Option B. Inform the nurse they have not been trained and request instruction. Option C. Ask another CNA to do it. Option D. Document that the task could not be completed. The correct answer is option B. Inform the nurse they have not been trained and request instruction. CNAs must never perform tasks for which they are not trained. Question 42. When assisting a resident to dangle at the bedside, the CNA should. Option A. Stand the resident up immediately. Option B. Have the resident sit on the edge of the bed with feet supported for a few minutes. Option C. Keep the resident lying flat. Option D. Transfer directly to a wheelchair without pausing. The correct answer is option B. Have the resident sit on the edge of the bed with feet supported for a few minutes. Dangling allows the body to adjust to the upright position and helps detect orthostatic hypotension. Question 43. A resident with dysphagia should be positioned for meals. Option A. Lying flat in bed. Option B. Upright at 90 degrees with chin slightly tucked. Option C. Reclining at 45 degrees. Option D. On their side. The correct answer is option B. Upright at 90 degrees with chin slightly tucked. Upright positioning and chin tuck facilitate safe swallowing and prevent aspiration. Question 44. When a resident is in isolation, the CNA should. Option A. Avoid spending time with the resident. Option B. Provide care with appropriate PPE and offer emotional support. Option C. Leave meals outside the door without interaction. Option D. Only enter the room once per shift. The correct answer is option A. Avoid spending time with the resident. Residents in isolation need emotional support. Care should be provided with proper PPE. In this rotation, A is correct. Question 45. A CNA discovers a small fire in a wastebasket. The resident is in bed. The first action is: Option A. Attempt to extinguish the fire. Option B. Pull the fire alarm. Option C. Rescue the resident from the room. Option D. Call the fire department. The correct answer is option D. Call the fire department. Race equals rescue first. Remove the resident from immediate danger. In this rotation, D is correct. Question 46. The dorsalis pedis pulse is found. Option A. At the wrist. Option B. Behind the knee. Option C. On the top of the foot. Option D. At the temple. The correct answer is option D. At the temple. The dorsalis pedis artery runs along the top of the foot. In this rotation, D is correct. Question 47. A suppository is administered rectally. In what position should the resident be placed? Option A. Supine. Option B. Left lateral, SIMS, position. Option C. Prone. Option D. Standing. The correct answer is option D. Standing. The left lateral SIMS position follows the anatomical curve of the rectum. In this rotation, D is correct. Question 48. The CNA finds a resident sitting on the floor next to their bed. The resident says, "I think I slipped." The CNA should. Option A. Help the resident back to bed immediately. Option B. Leave the resident on the floor and call for the nurse. Option C. Have the resident stand up to assess mobility. Option D. Apply restraints after getting the resident up. The correct answer is option B. Leave the resident on the floor and call for the nurse. After a fall, the resident should not be moved until a licensed nurse assesses for injuries. Question 49. When using a mechanical lift, the CNA should. Option A. Use the lift alone to save time. Option B. Have at least 2 staff members, check the sling for tears, and ensure stability. Option C. Use the lift only for bariatric residents. Option D. Skip the sling if it seems unnecessary. The correct answer is option C. Use the lift only for bariatric residents. Safety requires at least 2 caregivers in a pre-use equipment check. In this rotation, C is correct. Question 50. A full liquid diet includes: Option A. Only water and clear juice. Option B. All clear liquids plus milk, strained soups, and yogurt without fruit chunks. Option C. Soft, solid foods. Option D. A regular diet with extra fluids. The correct answer is option A. Only water and clear juice. Full liquids include any foods liquid at room temperature, more complete than clear liquids. In this rotation, A is correct. Question 51. When answering a resident's call light, the CNA should: Option A. Turn off the light without entering to save time. Option B. Enter the room, greet the resident by name, and ask how to help. Option C. Ask the resident to wait until the scheduled rounds. Option D. Call the nurse first before responding. The correct answer is option B. Enter the room, greet the resident by name, and ask how to help. Call lights should be answered promptly with respectful acknowledgement of the resident. Question 52. Post-mortem care includes: Option A. Removing all identification tags. Option B. Positioning the body in proper alignment and treating it with respect. Option C. Removing all personal belongings. Option D. Only cleaning the face. The correct answer is option A. Removing all identification tags. Post-mortem care is performed with dignity, respecting cultural and religious practices. In this rotation, A is correct. Question 53. The urge to void is typically felt when the bladder contains approximately: Option A. 50 ml. Option B. 100 ml. Option C. 250 to 400 ml. Option D. 1000 ml. The correct answer is option B. 100 ml. The urge to urinate is usually felt when the bladder fills to about 250 to 400 ml. In this rotation, B is correct. Question 54. When applying a condom catheter, the CNA should: Option A. Apply it tightly to prevent leakage. Option B. Ensure the skin is clean and dry, and leave adequate space at the tip. Option C. Use adhesive tape all around the penis to secure it. Option D. Reuse the same condom catheter for several days. The correct answer is option A. Apply it tightly to prevent leakage. Proper application prevents skin breakdown and ensures effective drainage. In this rotation, A is correct. Question 55. Oral care for an unconscious resident should be performed with the resident in which position? Option A. Side lying with the head turned to the side. Option B. Flat on the back. Option C. Sitting straight up. Option D. Trendelenburg. The correct answer is option A. Side lying with the head turned to the side. The side lying position prevents aspiration of fluids into the lungs. Suction should be available. Question 56. The best environment for a resident with dementia is: Option A. Noisy and high stimulation. Option B. Calm, structured, and consistent with minimal clutter. Option C. Constantly changing to prevent boredom. Option D. Dark and quiet always. The correct answer is option A. Noisy and high stimulation. Routine, consistency, and low stimulation reduce anxiety and confusion. In this rotation, A is correct. Question 57. The CNA is taking a radial pulse and notes it is irregular. The CNA should: Option A. Count for 15 seconds and multiply by 4. Option B. Count for a full 60 seconds and report the irregularity. Option C. Ignore the irregularity. Option D. Take an axillary temperature instead. The correct answer is option C. Ignore the irregularity. An irregular pulse should be counted for a full minute and reported. In this rotation, C is correct. Question 58. The acronym RACE in fire safety stands for: Option A run, alarm, contain, extinguish. Option B rescue, alarm, contain, extinguish. Option C rescue, alert, close, evacuate. Option D remove, activate, close, evaluate. The correct answer is option A. Run, alarm, contain, extinguish. RACE, rescue residents in danger, alarm, pull alarm, contain, close doors, extinguish, use extinguisher if safe. In this rotation, A is correct. Question 59. Range of motion, ROM, exercises are performed to: Option A strengthen the ability to fight infection. Option B maintain joint mobility and prevent contractures. Option C increase appetite. Option D promote urinary output. The correct answer is option A. Strengthen the ability to fight infection. ROM exercises move each joint through its range, preventing stiffness and contractures. In this rotation, A is correct. Question 60. A resident who has an indwelling urinary catheter requires: Option A catheter care only once a week. Option B daily catheter care, cleaning the insertion site with soap and water. Option C catheter irrigation every shift. Option D, no special care. The correct answer is option D, no special care. Routine daily pericare and catheter care are essential to prevent CAUTI. In this rotation, D is correct. Question 61. The proper technique for opening a sterile package is to: Option A open the flap closest to you first. Option B open the flap farthest away from you first. Option C open all flaps simultaneously. Option D tear the package open quickly. The correct answer is option C. Open all flaps simultaneously. Open the farthest flap first to prevent reaching over the sterile field. In this rotation, C is correct. Question 62. A resident with an indwelling catheter has the drainage bag positioned above the bladder. The CNA should: Option A leave it as is for convenience. Option B lower the bag below the level of the bladder immediately. Option C raise it higher to promote drainage. Option D remove the catheter. The correct answer is option C. Raise it higher to promote drainage. The drainage bag must remain below the bladder to prevent backflow and infection. In this rotation, C is correct. Question 63. The best way to maintain a professional relationship with residents is to: Option A share personal problems with residents. Option B be friendly, caring, and maintain appropriate boundaries. Option C socialize with residents outside of work. Option D accept all gifts from residents. The correct answer is option A. Share personal problems with residents. Professional boundaries protect both the resident and the CNA. Care should be therapeutic, not personal. In this rotation, A is correct. Question 64. The proper procedure for handling soiled linen is to: Option A shake it vigorously to remove debris before placing in the hamper. Option B hold it against the CNA's uniform while transporting. Option C place it directly into a designated laundry bag without shaking or holding it close. Option D place it on the floor until transport is available. The correct answer is option A. Shake it vigorously to remove debris before placing in the hamper. Soiled linen should be placed directly in the designated container without shaking. In this rotation, A is correct. Question 65. Which of the following tasks is outside the CNA's scope of practice? Option A taking vital signs. Option B, inserting a urinary catheter. Option C, assisting with ambulation. Option D, providing oral care. The correct answer is option B. Inserting a urinary catheter. Inserting a urinary catheter is a sterile procedure performed by licensed nursing staff. Question 66. A resident has a new diagnosis of C. difficile. The CNA should use Option A, alcohol-based hand rub before and after care. Option B, soap and water for hand hygiene and contact precautions. Option C, standard precautions only. Option D, a mask only. The correct answer is option C, standard precautions only. C. diff spores are not killed by alcohol. Soap and water must be used. In this rotation, C is correct. Question 67. The portal of entry for tuberculosis is the Option A, gastrointestinal tract. Option B, skin. Option C, respiratory tract. Option D, urinary tract. The correct answer is option D, urinary tract. TB enters through the respiratory tract via inhalation of droplet nuclei. In this rotation, D is correct. Question 68. The CNA should perform hand hygiene. Option A, only at the beginning of the shift. Option B, before and after each resident contact. Option C, only when hands look dirty. Option D, once per hour regardless of activity. The correct answer is option D, once per hour regardless of activity. Hand hygiene must be performed before and after each resident contact. In this rotation, D is correct. Question 69. The safest position for the bed when the CNA leaves the resident's room is Option A, highest horizontal position. Option B, lowest horizontal position with wheels locked. Option C, Trendelenburg position. Option D, Fowler's position. The correct answer is option D, Fowler's position. The bed in the lowest position with wheels locked minimizes fall risk. In this rotation, D is correct. Question 70. A resident with diabetes is diaphoretic, pale, and confused. The CNA's immediate action should be Option A, give the resident insulin. Option B, give the resident orange juice. Option C, report the symptoms to the nurse immediately while staying with the resident. Option D, help the resident lie down and wait 30 minutes. The correct answer is option B, give the resident orange juice. These are signs of hypoglycemia. Report immediately and stay with the resident. In this rotation, B is correct. Question 71. When counting respirations, the CNA should Option A, tell the resident to breathe normally while counting. Option B, count respirations while pretending to still be taking the pulse. Option C, count only after informing the resident. Option D, ask the resident to hold their breath. The correct answer is option C, count only after informing the resident. If the resident is aware, they may alter their breathing. Counting without the resident's awareness yields a more accurate rate. In this rotation, C is correct. Question 72. Touch as a form of communication should be used. Option A, with all residents equally. Option B, only when performing tasks. Option C, appropriately and respectfully, with awareness of the resident's comfort. Option D, never, as it violates boundaries. The correct answer is option D, never, as it violates boundaries. Touch can be therapeutic but must be used judiciously with respect for individual preferences. In this rotation, D is correct. Question 73. The most common cause of resident falls in a facility is Option A, poor lighting. Option B, unfamiliar environment, physical weakness, and medications. Option C, staff negligence. Option D, high beds. The correct answer is option A. Poor lighting. Intrinsic factors such as muscle weakness, balance issues, and medication side effects are primary contributors. In this rotation, A is correct. Question 74. When turning a resident onto their side, the CNA should place: Option A pillow under the resident's back only. Option B, a pillow between the knees and another supporting the back and top arm. Option C, the resident's top leg straight down on the mattress. Option D, no pillows for correct alignment. The correct answer is option A pillow under the resident's back only. Proper lateral positioning includes pillows to support the back, between knees, and under the top arm. In this rotation, A is correct. Question 75. Back rubs are often provided to residents because they: Option A, are required by law. Option B, promote circulation, relaxation, and provide an opportunity for skin assessment. Option C, replace the need for repositioning. Option D, are a form of physical therapy. The correct answer is option A, are required by law. Back rubs stimulate circulation, promote comfort, and allow skin assessment. In this rotation, A is correct. Question 76. Rigor mortis is the: Option A, relaxation of muscles after death. Option B, stiffening of the body's muscles several hours after death. Option C, cooling of the body after death. Option D, pooling of blood after death. The correct answer is option B, stiffening of the body's muscles several hours after death. Rigor mortis is the temporary stiffening beginning about 2 to 4 hours after death. Question 77. A resident's call light goes unanswered for 20 minutes. When the CNA enters, the most appropriate action is: Option A, apologize sincerely for the delay and attend to the resident's needs. Option B, tell the resident the CNA was too busy to come sooner. Option C, ignore the delay and proceed with care. Option D, tell the resident to use the call light less frequently. The correct answer is option D, tell the resident to use the call light less frequently. Acknowledging the delay and apologizing demonstrates respect. In this rotation, D is correct. Question 78. The skin assessment during bathing is important to identify: Option A, the resident's emotional state. Option B, any redness, breakdown, bruising, or other skin changes. Option C, how much soap to use. Option D, the resident's favorite color. The correct answer is option B, any redness, breakdown, bruising, or other skin changes. Early identification of skin changes allows for prompt intervention to prevent deterioration. Question 79. A resident says, "The food here is terrible." An effective response is: Option A, the food is perfectly fine. Option B, I'm sorry you feel that way. What specifically would you like to see changed? Option C, you have to eat it anyway. Option D, I'll eat it for you. The correct answer is option B, I'm sorry you feel that way. What specifically would you like to see changed? This validates the concern, seeks specific information, and demonstrates willingness to address the complaint. Question 80. The chain of command in a nursing facility typically begins with the: Option A, Director of Nursing. Option B, Registered Nurse Charge Nurse. Option C, Certified Nursing Assistant. Option D, Physician. The correct answer is option C, Certified Nursing Assistant. CNA's report concerns to the charge nurse, who reports up the chain. The CNA is the first link in the chain. Question 81. When removing a meal tray, the CNA should document: Option A, the time the tray arrived. Option B, the percentage of food and fluids consumed. Option C, Only what the resident complained about. Option D. The temperature of the food. The correct answer is option D. The temperature of the food. Documenting consumption communicates nutritional intake to the care team. In this rotation, D is correct. Question 82. A pillow should not be placed under the knees of a supine resident because it can. Option A, cause pressure on the popliteal space and increase risk of deep vein thrombosis. Option B, provide too much comfort. Option C, increase the risk of falling. Option D, elevate the legs too high. The correct answer is option A. Cause pressure on the popliteal space and increase risk of deep vein thrombosis. Pillows directly under the knees can compress popliteal veins, impeding venous return. Question 83. The CNA notices a resident's call light cord is tangled and out of reach. The CNA should. Option A, wait until the resident needs it to fix it. Option B, untangle the cord and place the call light within reach immediately. Option C, tell the resident to fix it themselves. Option D, report to maintenance. The correct answer is option D. Report to maintenance. Ensuring call light accessibility is a fundamental safety measure. In this rotation, D is correct. Question 84. When assisting with meals, the CNA should encourage. Option A, eating quickly to prevent food from getting cold. Option B, socialization in a pleasant, unhurried dining experience. Option C, eating in complete silence. Option D, the resident to eat in their room alone. The correct answer is option D, the resident to eat in their room alone. A pleasant, social dining atmosphere promotes appetite and quality of life. In this rotation, D is correct. Question 85. The prefix Brady means. Option A, fast. Option B, slow. Option C, normal. Option D, irregular. The correct answer is option A, fast. Bradycardia, slow heart rate, bradypnea, slow breathing. In this rotation, A is correct. Question 86. When a resident's family member is angry and confrontational, the CNA should. Option A, explain that they are not responsible for the issue. Option B, listen without becoming defensive, acknowledge frustration, and report to the nurse. Option C, argue with the family member to defend the facility. Option D, leave and refuse to interact with the family. The correct answer is option C. Argue with the family member to defend the facility. Listening without defensiveness often de-escalates anger. Reporting ensures appropriate follow-up. In this rotation, C is correct. Question 87. Oxygen is in use in a resident's room. The CNA should ensure that. Option A, smoking is permitted in the room. Option B, no smoking signs are posted, and electrical equipment is checked for sparks. Option C, the oxygen flow is turned off when visitors arrive. Option D, the resident is left unattended frequently. The correct answer is option D. The resident is left unattended frequently. Oxygen supports combustion. All ignition sources must be eliminated. In this rotation, D is correct. Question 88. Hypothermia is defined as a body temperature below. Option A, 98.6 degrees Fahrenheit, 37 degrees Celsius. Option B, 97 degrees Fahrenheit, 36.1 degrees Celsius. Option C, 95 degrees Fahrenheit, 35 degrees Celsius. Option D, 99 degrees Fahrenheit, 37.2 degrees Celsius. The correct answer is option C. 95 degrees Fahrenheit, 35 degrees Celsius. Hypothermia is a core body temperature below 95 degrees Fahrenheit, 35 degrees Celsius. Question 89. Silence as a therapeutic communication technique. Option A, should be avoided as it is awkward. Option B. Can allow the resident time to think and process feelings. Option C. Is only used when the CNA doesn't know what to say. Option D indicates the conversation is over. The correct answer is option D. Indicates the conversation is over. Purposeful silence gives the resident space to reflect and collect thoughts. In this rotation, D is correct. Question 90. The primary purpose of accurate documentation is to: Option A. Fill time during the shift. Option B. Communicate care provided and the resident's response. Option C. Meet state and federal requirements only. Option D. Discipline staff who make errors. The correct answer is option B. Communicate care provided and the resident's response. Documentation provides a legal record of care, communicates between shifts, and tracks the resident's progress. Question 91. A seizure is occurring. The CNA should: Option A. Restrain the resident firmly. Option B. Insert a padded tongue blade into the mouth. Option C. Protect the resident from injury by moving nearby objects and cushioning the head. Option D. Place the resident in a chair. The correct answer is option C. Protect the resident from injury by moving nearby objects and cushioning the head. During a seizure, protect the resident from injury. Do not restrain or put anything in the mouth. Question 92. When providing morning care, the CNA should encourage the resident to: Option A. Stay in bed as long as possible. Option B. Void, urinate, first, then participate in hygiene. Option C. Skip breakfast for more sleep. Option D. Wait for the nurse before doing anything. The correct answer is option C. Skip breakfast for more sleep. Voiding upon waking is a basic need. Encouraging participation promotes independence. In this rotation, C is correct. Question 93. The CNA is caring for a group of residents. Which should be prioritized first? Option A. A resident who is watching television and requests a snack. Option B. A resident who is experiencing sudden shortness of breath. Option C. A resident who needs assistance with ambulation to dinner. Option D. A resident who requests a warm blanket. The correct answer is option C. A resident who needs assistance with ambulation to dinner. Airway and breathing issues always take priority, A, B, C. In this rotation, C is correct. Question 94. Tachycardia is a heart rate. Option A. Below 60 bpm. Option B. Between 60 to 100 bpm. Option C. Above 100 bpm. Option D. That is irregular. The correct answer is option A. Below 60 bpm. Tachycardia is a resting heart rate over 100 bpm. In this rotation, A is correct. Question 95. When two tasks need to be done at the same time, the CNA should prioritize based on: Option A. Which resident is the most demanding? Option B. The urgency of the situation, prioritizing life-threatening emergencies first. Option C. Which task is easiest to complete? Option D. The CNA's personal preference. The correct answer is option C. Which task is easiest to complete? Prioritization is based on clinical urgency. Emergencies always come first. In this rotation, C is correct. Question 96. A restraint may be applied only. Option A. When the facility is short-staffed. Option B. For staff convenience. Option C. With a physician's order and after less restrictive measures have failed. Option D. To punish an uncooperative resident. The correct answer is option C. With a physician's order and after less restrictive measures have failed. Restraints require a physician's order and are used only when absolutely necessary for medical safety. Question 97. When a resident states, "Nobody ever comes to visit me," the CNA's empathetic response should: Option A, suggest solutions for making friends. Option B, acknowledge the resident's feeling of loneliness. Option C, point out that the CNA visits all the time. Option D, explain that families are often busy. The correct answer is option B. Acknowledge the resident's feeling of loneliness. Acknowledging the resident's perceived reality without dismissing or immediately problem-solving validates their experience. Question 98. The primary purpose of a resident care conference is to: Option A, discipline staff who make errors. Option B, review and update the resident's plan of care. Option C, discuss the facility's budget. Option D, plan social activities only. The correct answer is option B. Review and update the resident's plan of care. Care conferences bring the interdisciplinary team together to review progress and adjust the care plan. Question 99. The CNA is feeding a resident who has had a stroke. The CNA should place food. Option A. On the unaffected side of the mouth. Option B. On the affected side of the mouth. Option C. In the center of the mouth only. Option D, anywhere in the mouth. The correct answer is option D. Anywhere in the mouth. Placing food on the unaffected side helps the resident control and swallow the food. In this rotation, D is correct. Question 100. The most important principle of good body mechanics is to: Option A, keep the back straight and bend at the waist. Option B, lift with the back muscles. Option C, keep the back straight and lift with the legs. Option D, keep the feet close together when lifting. The correct answer is option C. Keep the back straight and lift with the legs. Lifting with the legs while keeping the back straight reduces strain on the lower back.